everybody. Tim Wyatt, clinical specialist here with the Aspen After Surgery Center. We are here with Kelly, who is one of our most recent patients who has done absolutely phenomenal. Kelly, hello, welcome. How is everything?
Thank you. Everything's been really good so far. It's been a few weeks since I've seen you guys, and so far so good.
Beautiful. So Kelly was recently discharged. She had gone through the full course of treatment, discharged. No program, no massages, no nothing. She's done. She's back to living her life. My joke with my patients is you are clinically done thinking about your breast. The only time I want you to think about your breast now is when it's something non-clinical. So we forget about the fact you had capsular contracture and we just live our life. So Kelly, in your case, to give some people some feedback, you had your first breast augmentation a number of years ago. You had gotten capsular contracture on your left breast. You had then done a revision on that breast, and true to the statistic of capsular contracture, you got a capsule again. Let's start with that. You have arguably one of the top surgeons here in Florida. We mention this in every video that regardless of the skill set of your surgeon, capsular contracture is us. It's our body, our autoimmune system. We make it, which is why it's difficult for the surgeon to really dictate the outcome because we make it. It's our autoimmune systems, right? So in your case, your body just kept rejecting that implant, kept getting a capsule. You said, forget it, this is it, I'm not having a third surgery. Found out about the Aspen Center, you came for treatment. And you did fantastic. We just reviewed your pictures. You're practically level. I'm going to pop up a picture here in a second. You can see that Kelly was about 1.6 centimeters elevated on that affected breast. She was a grade 3 capsule, where the grade is 1 through 4. 4 is the worst. She was a 3. Treated her. She's now almost perfectly symmetrical at the bottom. At the top, take a look at the picture right here. This is her after photo, and we've got really good softness, really good look. So, Kelly, if you had to rate how much softer your breast is now that they're all done and everything, from 0 to 100%, what would you give it?
Yeah, I would say since I came to now, it's probably 80 to 90% softer than when it was before.
Beautiful. And you know, we just looked at the before and after photos, how you were up here, and now we've got that equal line measure. Same question, from 0 to 100%, my breasts look the same. What would you give it as your number?
I would say definitely as well, 80 to 90%. And I could wear, shirts and tops that I wasn't wearing before. So just that makes me a lot happier too.
Yeah. So anybody out there watching this who's dealing with contractures, one of the easiest ways to find out if indeed this is capsular contracture and an issue is it's that classic high fullness, especially in a bikini, a low cut V, a low shirt, anything like that, in which you see kind of the top of one breast ballooned up and fuller versus the other one is lower and in your mind looks better. It's really easy to check. Basically take your thumbs, squeeze the breast that's higher, and if it feels firmer, meaning you don't sink in with your thumbs versus the good side that sinks in easily, that's pretty much a guarantee that that's capsular contracture. The good news is there's a non-surgical treatment for it. Now, unfortunately, the surgical community, as Kelly is a victim of, does not refer for non-surgical options like this. Unfortunately, surgeons get paid to do surgery. So the reality is their solution is going to be surgery. But unbeknownst to most people, and Kelly, I'm sure you know the stats, we've probably chatted with you about this, a surgeon revising a capsule has a 70 to 90% failure rate. Kelly is a victim of that statistic. She's evidence that that statistic is true because she had her revision surgery with a top plastic surgeon and got a capsule. Again, if you were to, Kelly, if you were to go to surgery again, your stat goes from 90 to 100% guarantee, and you paid for that. So Aspen Stats research, close to 9,000 patients treated to date. Our research has proven this in our retrospective studies. Numerous doctors, 90% success rate, being able to move 2 Baker grades, meaning getting you from a 3, which is what you are, to a 1, which is normal. So you are literally that 90% stat that we have. even Kelly, if you were that 10%, we still have a game plan, a plan B, but we like to go with plan A because it's simpler, it's easier, and it's cheaper. So you did really, really well. So now things like laying on your tummy, you don't feel that lump pushing back on you anymore, right? If you're laying on that affected side, you don't feel like this big lump of hard ball pushing back into you. Anything else functionally, like you feel better or look better, that before were a problem that now you don't notice?
Yeah, well, that was one of the things I told Gina, my like rehab specialist. Like that was the biggest thing I realized is like laying down. I used to like feel that it was like this hard ball. Now it feels like almost 100% better. But yeah, like I said, just like wearing shirts, like there was a lot of shirts that I had that I couldn't wear without a bra because it looked uneven, like especially you said at the top, but even like at the bottom, you could see like it was
Right.
even. So the fact that I can even wear these shirts in public now without a bra or with just like a little like cami that has no padding, like
Right.
that is huge to me because I mean I'm still young. We live in Florida. It's hot. We're always wearing tank tops, bathing suits, etc. And I was so self-conscious before, and now like it looks almost 100% even that you know you would have to have like a magnifying glass to see that it wasn't like perfect, but it's almost perfect. So to me, it was totally worth it, and I feel a lot better and more confident in my clothes and a bathing suit, etc. So I'm definitely happy I did it.
Yeah, that's the result that we're looking for. You did great. Your before and afters are awesome. Um, the trick is going to be for women like you to be able to get this treatment. Now, Kelly is local here to us, so she came into our South Florida facility. For anybody watching this, we offer an international treatment program where, with as simple as a Zoom call, we can do a Zoom virtual evaluation, take a look at you, make sure that this is a capsule. If it's not, we can even advise you on what to do. Maybe you do need to have surgery. We can act as a second set of clinical eyes and ears to help you for that. But if not, we offer a 5-day fast track, which if indeed you are a candidate, you basically fly in one weekend, you do 5 days of treatment, you fly out the following weekend, you're about 80% better, give or take, and then you do a 30-day home program to continue to get better, which is exactly what happened with Kelly. Even though she's a local patient, we did her treatment on her, but she still had another 30 days to go. And even between the last time we saw her and did her reassessment, had huge progress, big difference even in that last 30 days. So everybody take a look at the banner below. You'll see the 877 number. Definitely take a look at all of our other YouTube videos. Hit us up on our Instagram, any of our social media. It'll give you a way better idea of what to expect, what we're doing, because the bottom line is doing surgery is the worst clinical option that you have. Even if your surgery is for free, there's implant manufacturers that will insure just the implant and the anesthesia. They will not pay for the doctor. They will not pay for any ancillary fees. Even if you got this surgically for free, you're almost guaranteeing yourself another capsule. So what's it worth? You got it for free, but it was your worst option. Do the Aspen treatment, knock it out, no downtime. Was there pain? Did the treatment hurt at all, Kelly? Pain or discomfort?
No pain, no discomfort. It was pretty easy. And I was gonna say, actually, I saw results the first week too. Like I was literally in shock. So it was like within the first week, it was pretty much level. It only got better after I kept doing everything, but like within the first week, I saw amazing results. I was in shock. I was like, I don't get how this could even happen so fast. But yeah, so no pain, thank God. So
Get that a lot. The clinical course is all patients get better in their very first session. I know your clinical evaluator probably asked you to check it after the very first treatment, and you probably squeezed it and said maybe it's like 20-30% softer. All patients go through the normal course where it's immediate improvement, immediate softening, and then it takes time to get the drop, the position, the pain to go away. But again, to be able to do it, no surgery, no downtime, no restriction, no limitations, exercise what you want, vote for who you want to vote for, get a vaccine if you want to get a vaccine or not. Nobody cares. We don't care what you do. All you need to do is actually get here physically for the treatment, do your home program, which is an important part. Let's talk about that. You know, you had stuff to do at home. You had to do certain massages in a home program. You were compliant with that and you did a pretty good job with it. Again, we say this all the time. This is not some magic machine. It's not a magic pill. It's not a magic potion. It's a therapeutic treatment protocol with some very specific tech, hands-on, and guidance by our clinicians that get patients to where they want to go. Because the current community, and you were a victim of this, your doctor put you on the asthma med, either Accolade or Singular. That didn't help you at all, not once, but twice.
Yeah,
I mean, the
Singular
statistics
did nothing.
it did nothing. We have patients right now who are watching this who are violently massaging their breast because their surgeon told them it was going to help. Doesn't help. They stop massaging. It's hard again. They take vitamin E. Up, it's still hard. It didn't help. I took the medications. You know, I used this laser, and then there was this something wave machine, and I did all this. And then they finally reach out to us, and we explain to them clinically why A, none of those work. B, they're not researched. C, they're not FDA approved. You know, these are all smoke and mirror type of campaigns versus the Aspen Center. We are all licensed medical professionals. We are all clinical specialists with medical degrees in our respective rehabilitative fields. So, you know, you're being seen by an expert on this. So Kelly, thanks for doing so awesome. Thanks for doing the video here with us today. If anybody wants to, like, you know, reach out to you, can we leave maybe your email and, you know, connect the two of you by email or use you as a reference just so they can see that you're a real human being, that you're not a crisis capsule actor, and that you were actually a patient here. Would that be okay?
Yeah, of course. I would love to help other ladies out. Just let them know that this is an option. Because again, I found you guys off Googling, so nobody really referred me, and I was just looking for any other second option outside of surgery since I had already tried that. So yeah, I mean, I would love to be a reference for you guys.
Beautiful. All right. Well, Kelly, you be well, stay well, and we'll be in touch. Okay. Take care.
Thanks, Tim.